Good afternoon, and welcome to NAMI New Jersey's weekly webinar series. My name is Lisa Powell, and I am the Director of Outreach Services and Program Coordinator for ACT Now, the African American Community Together Now in NAMI, New Jersey. Today's topic is Staying Senior Tough during the COVID-19 crisis and beyond. We are honored to have our distinguished guest speaker, Dale Ofei-Ayisi, joining us today. Dale has over 45 years of postmaster's clinical and administrative experience in medical and behavioral health social work with patients experiencing a host of end-stage illnesses, including cancer, Alzheimer's disease, heart disease, and neuromuscular diseases. She has direct practice and supervisory expertise in geriatrics and dementia care, critical care, rehabilitation, and supervisory expertise. Before retiring from the field of social work in community health education in 1975, Dale worked as an outpatient oncology social worker 3 for the Department of Radiation Oncology and outpatient infusion for the J. Phillip Citta Regional Cancer Center at Community Medical Center, Robert Wood Johnson, Barnabas Health in Toms River, and has been a recipient of their I Made a Difference Award 3 times. She served as a clinical social worker for the Geriatric Evaluation and Management Services at former Kimball Medical Center for 8 years and was a recipient of the St. Barnabas Excellence of Caring Award in 1999. She also served as a senior social worker for Monmouth Medical Center's Anna Alexander Greenwald Geriatrics Program from 1991 to 1994. Dale served for 14 years as a coordinator of community services for COPSA Institute for Alzheimer's Disease and Related Disorders at Rutgers University Behavioral Healthcare in Edison, including program supervisor of their caregiver-focused outreach program, EARS for Caregivers, and was a recipient of the Rutgers UBHC Excellence Award for July 2005. Dale, we are grateful that you are here, and we look forward to your presentation, and I will now pass it on to you.
Thank you very much, Lisa, and thank you all in the audience for allowing me the honor and the pleasure of presenting to you today. Today, we're going to talk about the impact of the coronavirus on seniors and how you can stay what we call senior tough during this period and beyond. I will be sharing with you some information about why COVID-19 has been especially virulent for seniors, but most importantly, we're going to talk about some solutions. What can you do to not only survive, but thrive during this process? We know that in life, change is inevitable. We know the old sayings that man plans and God laughs, but we had no idea that what's been happening over the past 5 months would happen to any of us. Activities that we took for granted, be it our children or grandchildren going to work or school, you going to your local senior center, just going to the mall, and even keeping up with some of the non-COVID medical treatment that you may have all been put on hold for what seems to be an indefinite period, even though the country is now beginning to open up. We know that over 100,000 young, precious lives have been lost resulting from COVID, that there's been massive unemployment with people's concerns about how they would pay their bills, the loss of health insurance, and during all this potentially virulent killer is continuing to attack and strike with the end really being uncertain. We know that COVID has been devastating for a number of populations in our country, be it people that are medically compromised, people of color, disadvantaged people, but we know that it particularly has been devastating for older adults, and especially those that live in long-term care settings. The impact has been quite devastating for our seniors. Research has shown that social isolation, loneliness, and limited physical and social activity can literally be deadly for seniors and can cause, again, premature death. One of the issues that happens, and when people are socially isolated, there's no one around them that can alert them if there's changes in their health care. For example, they're most likely, the seniors that are most likely at risk are those that live in situations that might inadvertently increase their risk of contracting the virus, such as living in close quarters with family members, or having to take public transportation because they no longer drive. They may need ongoing home care assistance from whom I call the angels of mercy, home health aides that come into their home and provide personal care assistance. These home health aides also are putting their life at risk, helping others. But because they're caring for so many other seniors, again, they may unwittingly be carrying the virus into that senior's home. Again, many seniors live alone and are in need of this home care assistance but don't get it. And it obviously can't be provided by Skype or Facebook. Seniors with Alzheimer's disease and related dementias and their family caregivers are at particular risk and face major difficulties. This list is not exhaustive, but some of the issues that they're facing are that the senior with Alzheimer's or dementia may not remember or see their need to follow the CDC guidelines, washing your hands frequently, wearing masks, socially distancing. And it may create constant conflicts with family members that are, again, trying to help them do the right and the healthiest thing. Hospitalizations can be extremely challenging, not only for that person, but for their family who may not be allowed to come into the hospital. And they're the ones that advocate for that person, that are their voice or their eyes and ears. It may be distinctly challenging for staff that may not understand how to help a person with dementia. The person that may be trying to get out of bed, may be trying to take off their oxygen or disconnect from the ventilator. The fear when they see people coming towards them gowned up and masked up and they don't understand what's happening. Avenues providing important dementia management assistance to help families manage their loved ones' care, such as adult daycare, home health aides, additional family members coming in to support, may now be unavailable or severely limited. And the result is that these already stressed family caregivers, the people that I call the unsung heroes and heroines, are becoming increasingly overwhelmed and anxious and fearful of what will happen, especially if they themselves may contract the COVID-19 virus. Sharing something with you. I'll be talking with you today from what I call two sides of the desk. Not only am I a professional who worked many years with seniors, I'm also a family caregiver and currently caring for my dear mom, 88 years old, who's dealing with a lot of chronic medical conditions. And just yesterday, we ended up at the emergency room. She woke up in physical distress, and we made the decision to go to the emergency room. And I had the experience of having to sit outside of the hospital, scared to death, wondering what was happening, trying to maintain contact with the staff who, again, kudos to Central State emergency room nursing staff. They were absolutely wonderful. But just imagining what would happen should she have to be hospitalized, and that I didn't have access to her or to be able to come in and comfort her, to help work with the staff in promoting her care. While the CDC guidelines are vital, to protect yourself and protect other people, Life in quarantine is not easy and also carries with it some risk. There's been a definite uptick in reports of anxiety, depression, anger, insomnia, and what we know will probably be post-traumatic stress. The dealing with the constant uncertainty of how long this is going to be, how long, whether or not I'm going to catch the disease, how severe it's going to be. One writer coined this as pandemic purgatory, which is a very apt description. Quarantine tends to heighten already existing or hidden problems. And one of the issues that we're seeing now is a dramatic uptick in domestic violence incidents and alcohol and drug abuse and relapses worldwide. The lockdown has, because of, again, the social isolation, the loss of jobs, many victims of domestic violence are literally trapped in their homes with their perpetrators and very afraid to reach out for help for fear that perpetrator is going to hear them. People who have been trying to recover from alcohol and drug abuse by going to their AA meetings, by keeping social connections, now are resigned to being very socially isolated and finding that this is causing relapse. According to the American Psychological Association, more than a third of Americans are reporting that this current crisis is causing serious impact upon their mental health and mental well-being. And before the end of my discussion, I will be sharing with you a number of resources that are very important for you to have. And hopefully, if you need them or you know someone that needs them, please feel free to share. The psychological impact, again, is unprecedented. And many mental health experts throughout the country are trying to provide education and support online to people of any age that are really suffering during this pandemic. But one thing to know is that we're all in this together, and there are some common reactions to this pandemic that people throughout the world are sharing because of the instability. Again, we're facing an unprecedented time when there's instability at every level: physical, social, emotional, economic. So in some ways it's normal not to feel able to cope at times, to feel panic, to feel, that feeling of uncertainty. There's a myriad of feelings that, again, are being reported throughout the world. The stress over the lost jobs and businesses, and with it, the loss for many people of health insurance, unpaid bills, family dysfunction, or working, or if people that are still working, especially in healthcare, working in a constantly high-risk job where there is daily, hourly fear that you are going to contract this virus and bring it home to your loved ones. Anxiety and dread, again, over catching the virus, over a loved one catching the virus and whether or not they'll survive, especially if they're one of those high-risk categories, people with pre-existing illnesses like cancer, heart disease, kidney disease, diabetes, that put you at much higher risk for contracting the virus and having a poor outcome once you contract the virus. Uncertainty, how long this will be, what life will be like during and afterwards, whether there'll be a change in job, change in relationships with the people that you love, and the feeling of being out of control and helpless under the weight of the uncertainty. Fear over the impact over, again, family members that you can't get to. Frustration and downright anger, watching this never-ending coverage or bickering on TV and newspapers and social media. I know myself, this past weekend, I took a Facebook holiday because of the constant barrage of negativity that I saw on Facebook and on television. I have to back up and say I really took a holiday from TV and just took a break from that, and made me feel a lot better. Most of all, sadness too over milestones, missed milestones, the high school kids that missed out on their graduations and their proms, and college graduates, weddings that had to be postponed, funerals that could not be held, and the sadness. It's important to note that the universal feeling of grief is underlying all of these emotions in response to these overwhelming losses. Grief is a reaction to the pain of loss, and again, is universal. The pain of missing a person or something that's been important in your life can cause you to go through, again, a myriad of reactions and suffering and longing. Those of you in the audience have probably recognized the name Elizabeth Kubler-Ross, who talked about those 5 stages of grief: denial, anger, bargaining, depression, and acceptance. And the fact that all of us don't go through that very neatly. Sometimes we may linger on one stage or another, but knowing that, again, this is universal. There's grief over what was lost, what could have been, and what never may be again. The fact that we may never be able to return to normal, quote unquote, whatever that was for you. Grief over the life that we had or thought we had, as far as our work life, our family life, and that whole sense of freedom and opportunities that may be missed now. That business owner who was building a healthy business who now may have to close their doors. Enjoyment and just taking life for granted. That we had we were able to live and enjoy. The lost time with families and friends, and again, those milestones I talked about. And I was so glad to hear here in New Jersey in July, the governor is going to allow students to have outdoor graduation. So hopefully that will mitigate some of this, this sad feeling of loss that we may not be able to get back. Most of all, the loss of human life. And the pain, the adding insult to injury, the pain of not being able to say goodbye, not being able to be with a loved one who might have been dying in the hospital from COVID or another chronic illness. And again, my kudos to healthcare workers who tried their best to try to mitigate that kind of pain by bringing a telephone and letting people have some face time to talk and to share and to say goodbye. Especially my kudos, I know, to valiant social workers as well as nurses and doctors who were out there on the front line trying to help families walk through this horrific experience and to bring comfort to that person who was dying. The fact that we can't hold rituals like formal religious ceremonies, religious homegoing ceremonies, has just added to the pain and suffering. But understand that again, grief is universal. We're in this together. There are, the fact that we are in it together to support each other in whatever ways we can, especially via social media, is critically important. So how do older adults build upon the toughness that that they have inside of them? I realize, again, as I said, that these seniors are at particular risk, and this disease has been devastating. But I think about the seniors, as I'm sure you all may too, that these are the very same seniors who represent a group of Americans who've witnessed and lived through some of America's most challenging experiences. The Depression, World War II, the Korean War, Vietnam, the Civil Rights Movement, the Holocaust during World War II, 9/11, They helped save the world from Nazi tyranny. They built America's industries and educational institutions, and they raised and taught a nation of children and grandchildren how to navigate the world around them. They've experienced success and failure in their lives and know that both can be fleeting and that you don't have to allow either to stop you. They've experienced meaningful losses in their lives, sometimes multiple losses of people and things that were important to them, and they had to learn to move on with life, sometimes, again, more than once. I found that one of the most meaningful aspects of my life, be it my work life or my personal life, in working in geriatric care, is the wisdom I learned from my clients, my patients, as well as the wisdom I learned from my very wise mother, grandmother, great-grandmother, and elderly aunts and uncles along the way. If you only listen to what they're saying to you. Seniors basically have learned to be resilient, and resilience, by what I mean by resilience, is the ability to bounce back from adversity. They've learned to be tough, what I call senior tough, and they can serve as role models for us. But unfortunately, illness, disability, decreased resources, social isolation, and unfortunately our society's ageism that views older people as non-productive, that makes them feel unable and unworthy. And because of all of that, many seniors have lost the confidence in themselves and their ability to stay senior tough. So what can be done to get it back? What can be done that during this difficult time, all of us can marshal confidence, resources, our own creativity, our own resiliency to be able to manage not only this pandemic, but beyond, because the pandemic is temporary. As hard as it is right now, know that it is temporary, and we'll go back to a life where we have a lot more choices, where we have more options. And hopefully some of the things I'm going to talk about now are things that people can remain and continue to keep themselves strong. It's very important to be mindful of your own emotional and physical needs and issues as you're going through this pandemic. Don't ignore them. It's very important and especially if they're feeling overwhelming, to reach out for help. Remember, though, the person that you were, especially you seniors. Remember that survivor that you've been in your life and the adversity that you overcame. That's still within you. Those capacities that you had to manage that change is still within you. Gather all your strength right now and face what you're facing right now with the courage and confidence that you showed in the past. There's someone on television said, and it was of note to me, we may not all be in the same boat, but we're all in the same storm. We're in this together. One of the blessings for lack of a better term, of this COVID experience has been an outpouring of support and help of each other, for your neighbors, for the healthcare workers, for the essential workers. It's been, in the midst of all the negativity that you're seeing on television, it's been just tremendous watching 7 o'clock every night, for example, the people in New York clapping every night at 7 o'clock in honor of the healthcare workers. The young people that in one of the Midwest towns that took it upon themselves to start a service where they were bringing seniors food from the supermarkets. That was wonderful. It's been showing the best. In some cases, we've seen the worst of ourselves as human beings, but this COVID experience has helped us look at the best in ourselves. It depends on, someone very wise once said to me, it's not that what happens in your life, but how you think about it and respond to it that'll determine how you overcome it. take an honest look at yourself. Are you one of those people that are the glass half full person, no matter what's happening in life, or the glass half empty, no matter how many riches you have, that there's always something negative to gleam onto? That's going to determine how you get through this COVID pandemic and beyond that. So I'm going to talk right now about how we build that toughness. And again, this is, I'm talking to seniors, but I'm talking to all of us, myself included, in how we can build upon the toughness within us during this pandemic and sustain it after the pandemic is over, to enhance our self-esteem, our confidence, and most of all, our quality of life. First, identify what control we have. Even though we may feel out of control, there is some modicum of control we still have over ourselves. Most of all, we never can control someone else, but we can always identify what we can do to adapt to a situation, to hopefully change a situation, to make it more positive. One of the things I found that's helpful is the 12-step programs, Alcoholics Anonymous, Overeaters Anonymous. Those programs that we know have been in existence since the 30s, who I find that have been a way of life, not only for the people that are involved in the programs, but for all of us. During my first job in 1975 was in an alcoholism rehabilitation, 28-day alcoholism rehabilitation program, and to continue some of the work that I did as a graduate student. And what I found is that I learned as much or more from those recovering alcoholics than I ever learned in school, about living, about coping, about changing your life. It was quite a monumental experience for me. Using the serenity prayer. God, grant me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference. And the tenet, living one day at a time. Yesterday's history, tomorrow's a mystery. Today is a gift. That's why they call it the present. Use those as your guides each day of reminding yourselves, what can you change? And the fact that you can take this in a step-by-step process so as not to overwhelm yourself. But again, being aware of how we can, what role we play in making life better for ourselves. Focusing on self-care. That is an absolute must. None of this means anything if we're too emotionally or physically sick to attend to any of what I'm going to be saying in the next few minutes. First of all, and again, this is a personal plea. Keep yourself as COVID safe as possible by following the CDC guidelines, please. Wash your hands frequently. When you go out, wear a mask. Keep social distance. Keep yourself as healthy as possible. Follow all those guidelines, especially for seniors, because this virus can be deadly. I know we've seen instances where there's been seniors they've shown on television that have survived, and I say that's absolutely wonderful. But again, those seniors that I mentioned that may be at particular risk, please don't play with your life. Follow those guidelines. You're not only protecting yourself, but you're protecting those people you love. You're protecting those strangers. You're showing that you care about people, and that, think about that little 5-year-old grandchild. You don't want to bring, any virus home to them. Use available telehealth services. I cannot tell you how helpful that's been personally in my life. My mom and I have had 3 telehealth meetings with her cardiologist, and it's been such a help, to allay our fears, to make some health changes that have been really, really supportive of her health. And the good thing now is that because of the need to social distance, there's been just a massive push to bring physical and mental health services online. Some of them, again, they realizing that people have lost health insurance. They're trying to provide services that are low cost or no cost. Please avail yourself of those services. Google telehealth services. Many of the health facilities provide telehealth services. I know that my former employer, Robert Wood Johnson Barnabas Health, developed a telehealth service several years ago. And the good news is that Medicare is now covering the cost for primary physicians to provide telehealth services, just as if you were walking in the doctor's office. Avail yourself of them. Keep yourself as healthy and as fit as possible if you're dealing with other illnesses that I say, again, make you more at risk for COVID. Do the things that the doctor says. Adequate sleep, critically important. Eating healthy, taking your regular medication, walking if you can. I know the gyms are closed, but nothing's going to stop you from going out in your backyard and taking a 10-minute walk. Those of you that have pets, your little pet is a lifesaver. Walking them twice a day or so is healthy for you. Learning and incorporating stress management techniques in your daily routine. Those of you that have never practiced meditation or yoga, that use prayer time and getting connected and reconnected with your spiritual life. Again, nature walks, listening to the birds singing. The good news is that there are many tutorials online on YouTube is fantastic. Before I retired, I didn't always have the time to go on YouTube and investigate things. There are some wonderful tutorials on how to start yoga and doing what mindfulness is all about. It's incredible, and it's free of charge. Utilize that. Learn and incorporate those stress management techniques in your life. Something basic like deep breathing, diaphragmatic breathing in through your nose, holding for a count of 4, and slowly breathing out through your mouth as if you're pursing your lips, as if you're blowing out a candle. During those times when you're feeling anxious, when you're feeling down, when you're feeling uncertain, do some deep breathing. Again, it'll help lower your heart rate and your blood pressure, and again, make you feel a little more centered. Again, this is the time you have the time now to learn and incorporate some of these important techniques in your life. Using rest and relaxation prepares our minds for change and are an essential part of our emotional and physical well-being, especially when we're stressed. Using this time to nourish yourself. It is not selfish. It is not self-indulgent. It is self-affirming, and it helps to save you, mentally and physically. Use aromatherapy, take a nice shower, put on some soothing music, playing with your pet. They say now that a lot of the pet shelters are empty because people have discovered they have enough time to get a little puppy or kitten, and the pet is happy and you're happy. All these things can fill your life with the power to know that you can live joyfully in spite of the problems and the devastation facing you, and they're so important to restoring yourself, to getting that sense of resilience. As I said, give yourself permission to take a periodic break from the TV news and from social media if you feel like, as I say, bathed in negativity. This is the time to turn that off and turn on a comedy. Look at an inspirational or uplifting movie. They're online. About a week ago, there was a posting that said 25 uplifting films, and I wrote a lot of them down. I'm sure you can get them and retrieve them online. But now that anybody that has HBO, I think is going to be starting HBO Max today, and people can stream it. There are a number of different resources that you can use. Even good old YouTube has movies. It's okay to escape at times. In fact, it is very important that you do. There is I know this will sound a little counterintuitive, but there are some unexpected benefits of dealing with adversity and anxiety, and as we talk about building overall resilience. Anxiety is not pleasant, obviously, but it can also serve to motivate us to make a move to change. We have a choice. We can sit there and stew and worry ourselves into a frazzle, or we can take some action. And sometimes that anxiety gives you the push to take some action. Adversity, I think we as human beings are born with the ability to make life better by life's difficulties. The struggle to heal and make sense of what's happened in our lives is the thing that builds strength in us, that builds self-confidence, that builds self-reliance, and builds those survival skills. It depends again on how you choose to look at it. Are you looking at the glass half full versus half empty, and use this time, this valuable time, to marshal your resources, to learn new skills, to look at things from a different perspective, to help us. We have a habit as human beings to catastrophize. I give you an example. When this first happened, I was alarmed. I would look outside. I live in an adult community, and I would look outside and see a number of my neighbors taking walks, which was great, but taking them without their mask on. And so I found myself looking out of the window, getting nervous, getting upset, saying, those droplets are coming out of their mouths. It's going to fly here to my house. We're going to catch the virus, and we're going to end up in the hospital and get sick, and God knows what's going to happen. I drove myself to a frazzle thinking that way. But then I had to stop myself and say, okay, are you staying indoors? Are you using a mask when you go outside? Are you literally, and you're going to laugh at me, literally washing down your mail when you go out and get the mail, or you're using gloves and washing down your mail with Clorox wet wipe? I don't do that anymore, but it made me feel more secure when I did. Are you doing all those things that are necessary? If you are, then relax, take a breath. So again, how we think about things is going to be tantamount to how we survive. Focus on physical. A lot of mental health professionals are talking and encouraging us to focus on physical distancing as opposed to social distancing. I know that the phrase social distancing has been it will be a part of our lingo forever now. But it's important to recognize that although we may need to be physically separated from each other, doesn't mean that we can't be socially connected to each other. There's a variety of ways we can keep in touch with people. It's vital for our overall well-being. Make a phone call to a friend just to say hi and see how you're doing. I cannot tell you how good it's made me feel to get and to give those phone calls to people that I care about people I haven't seen in years. I've had some wonderful conversations with friends that I used to live when I lived in California, and it was just wonderful experience. I'm going to be, in a few days, my mother and I are going to be attending a virtual wedding of a young woman who I remember the night that she was born, and to see her get married and to toast her, vicariously. We are so excited, as if we're actually in the room with her. We're going to be doing that this weekend. Writing letters, the old letter writing has gotten out of vogue, I guess. But what if you wrote a letter to someone? I know that's been so important to me, is to get a letter from someone. Email, Skype, Facebook, Zoom, the Zoom that we're on now. Even shouting at your neighbor from across the street to say how you doing, and how you feeling. All those things are vital. So remember, you don't have to be socially distant, although you need to be physically distant. Putting things in perspective. As I said, understanding that this pandemic is temporary, that eventually it will be a memory. But we need to be able to live in the meantime. So remind yourself every day, this is not going to be this way always. Life is full of gray areas. Sometimes we think that other things are black or white, and we're not subject to change. Well, I always did it this way. I can hear people say, we've always done it this way. This is an opportunity to change that, to try something new in the privacy of your own home. Understand that sometimes those shades of gray can help us marshal more resources to give us permission to do things a little differently. The importance of maintaining your sense of humor, I cannot stress that. Even though the things that are happening around us are certainly not funny or are devastating, it's important to catch those little moments with your kids, with your grandkids, what you see on television, that make things funny, that give you a laugh and a smile, even if it's just for a few moments at a time. Those are the things that give you that second wind and help you survive. Reaching out, I cannot stress this enough. Don't be afraid or ashamed to ask for help. If you find that some of those feelings that I said are very common are starting to become overwhelming, again, there has been an uptick in anxiety and depression, and what they're now calling deaths of despair, the increase in suicide among people, younger people, but older people are not immune to it. There is the highest rates, as you look at the highest rates of suicide in our country, throughout the world. Older men, especially those that have histories of alcohol and drug abuse, those that have lost a loved one, those who are facing chronic illness, have among the highest rates of suicide. And their suicide attempts tend to be more successful. So that, again, this is speaking to seniors also. If your depression, especially those people that have had pre-existing mental health issues such as generalized anxiety disorders, or major depressive disorders, again, it is critical that you reach out for help if you find that these feelings are exacerbated, that you're not functioning day to day, you're not getting out of bed, you're not returning phone calls or answering the phone, you're not eating, you're overeating or undereating, you're oversleeping or undersleeping. These are signs that you need help. Please, or especially if you have thoughts of self-harm, if you're lashing out at your loved ones, and exploding in anger. These are signs that you need help right away. And again, I'm going to be giving you some phone numbers that you can reach out to again, that can connect you to services, either online services that can help you or bring you into the hospital. Don't be afraid or ashamed to ask for help, please. Acknowledge and share your reactions to the situation. We're all going through it. Manage and challenge your thinking. I gave you an example of those thoughts I had when I saw some of my neighbors that we need to check ourselves and challenge ourselves. Maintaining structure and routine, very important. Having something to get up for every day. Get up I know it sounds trite, but make it a point to get up every day, bathe yourself, take a shower, wash yourself up, and dress every morning unless you are feeling so sick you can't get out of bed. That daily routine, make small goals for yourself. It's important to, you have a time to work on some important projects that you had. When I retired in January, one of my goals was to purge and so I've been able to do a lot more of that, of course, with having all this time, at home. But smaller projects are good too. Every day, set a goal for yourself. If it means I'm going to read 2 chapters of my favorite book instead of finding it on the floor when I try to read it at night when I'm asleep, when I'm half asleep, might be a goal. Cooking, something that you personally, feel that would derive a sense of accomplishment from, and to keep you daily focused, very important. Don't let your brain or your enthusiasm for life go idle and dull. Someone once said, an idle mind is like a bad little kid. It gets into trouble. It can get into trouble when it's idle. Use this time to learn something new. That's one of the best ways to keep your brain exercised. The brain is a big muscle, is like a big muscle, and it needs exercising just like the other parts of our body. When I was working, I used to teach a class on keeping your memory sharp in a lot of senior centers. And one of the things that I emphasize is that learning something new is one of the best ways to keep that brain exercised. And there are some wonderful free avenues to learn new topics, to learn about something new and actually practice something new. This is a time to start if you've had some projects and some things you've wanted to learn, like I want to learn how to knit or crochet, I want to learn how to cook this particular dish, or, this is the time to do it. You have unencumbered time to do this. If you want to get back to a favorite hobby, do that. It keeps your mind occupied. It keeps your mind focused. It's something you can actually share with someone online. What if you and a friend got online and actually did a project together? That's possible. YouTube, podcasts, TED Talks, Nat Geo on television, do-it-yourself books and programs on TV are ways to start. Try a form of expressive art. Expressive arts like music, painting, sculpture, those are that is one of the best ways to exercise the brain. It exercises different areas of the brain. Music especially, learning to play a musical instrument. When this first started, I had been starting piano lessons again. I'm a choral singer, and unfortunately, we learned that singing is one of the worst things you can do now because of the droplets that come out of your mouth, when you're singing. But nothing stops you from playing the piano. And there's tutorials on television. Get your keyboard and think about playing that musical instrument. Online concerts. Many of the major concert venues in the country have offered online free programs. The New Jersey Symphony Orchestra has on their website, you can listen to some of their past concerts. The Metropolitan Opera, I enjoyed watching Aida with Leontine Price a couple of weeks ago. It was absolutely magnificent. Free online from Metropolitan Opera. Virtual museums, some of the best museums in the world are showing virtual tours online, free of charge. Take a course, a college course. Many colleges now have to be online, but they're also, through their community education programs, are providing college courses, so including some of the Ivy League schools are having online programs. Take a class from Harvard, and so then you can tell your neighbors and friends, I studied a bit at Harvard, and have a little fun with that. Learning to accept change, most of all. This is not something, the change that we're going through right now is not something that necessarily anybody wants to go through, certainly. But fighting it is, again, counterproductive. Understanding how you're feeling about it, seeing what you can change and what you have to, we have to live with for a while, you're going to be better able to cope with the realities of the changes you're facing if you roll up your sleeves and do the best that you can, understanding that, again, there's no cookbook to this. You're going to try, there's a lot of this is trial and error, but looking at it from as positive as you can, challenging that thinking that tells you everything is negative is so important for our growth and our resilience, and something that seniors have had to learn over the years. They had to brush themselves off. When you're knocked down, you have to brush yourself off and get back up and start again. Most of all, viewing change as an opportunity for growth. There is a symbol, a well-known symbol called yin and yang. It's usually black and white. It looks like two commas up against each other. And this means, this symbol stands for crisis and opportunity. The Chinese believe that with every adversity comes a chance to change life, to build life, to grow life, to make things different. Viewing change as a new page in your book, in the book of your life rather than the end of your life, God willing. It can be a chance for you to start over in relationships, start over looking at how you think about things, starting over in what you plan for your life. Like that saying, life happens when you've made other plans. There's no shame in looking at whether or not is my life going the way that I want. I love reading stories about people, usually captains of industry, people that were in major industry, that were CEOs that chucked it all and became farmers or went to school to become social workers, or whatever, that again, and report that they're the happiest they've ever been in their lives. This is an opportunity to look at life now that we've had a pause from our lives, so to speak. This is a chance to say, was my life happy that the way it was, the normal that I was used to, was it really the life that I wanted? And that starting to start over and begin to map out what life can look like. Helping others. One of the best healers when we're hurting is to reach out to other people, is to think beyond ourselves. I always used to tell seniors, see yourself as a valuable resource that should not be wasted. And I'm saying that to myself because I am a senior now. I am a part of the club, and seeing that. Seeing yourself as that resource that can help other people. And again, social media has made it possible for us to do a number of things that we couldn't, and maybe we could not do before. Those grandkids that, again, the country is starting little by little to open up, but while you have them as captive audiences, this is a good time to have them teach you how to use Facebook, use Skype, use Zoom, mentor them, tell that, show them of things that that you've learned in your life that may be of value to them. Supportive phone calls, again, to other seniors that may not have the supportive family that you have, but need someone to tell them, everything is going to be okay, and I'm here for you. Making donations to food banks. I know all of you have seen the lines and lines of people using food banks throughout the country, because they've lost their jobs, they've lost income. What if you sent a donation? If you are able, sending monetary donations to food banks, sending them to domestic violence programs that are, again, finding this influx of people that are suffering. Sewing masks and gowns. I've seen people doing that, and I think that's absolutely wonderful. If you have the skills to sew, sewing the masks and gowns for nursing homes and local assisted living, and local senior apartment buildings. Very, very important. One of the things that has grown with this virus that's been positive has been the show of compassion. Empathy. You've heard that word, empathy. Empathy is the emotional is the response to, or the understanding of someone else's pain and suffering. And compassion is putting that empathy into action. Is making those gestures to support and care for someone else. I see this as what I call a twofer. Not only are you helping someone else, you are also helping yourself by feeling that you have a purpose in life, that, again, you have a chance to share with others your wisdom and experience and support. Lastly, I want to encourage all of you seniors out there in particular to protect yourselves during this period. Unfortunately, periods like this sometimes bring out the best in people, but oftentimes it brings out the worst in people. Please be careful for what's been known as the COVID-19 scam artists. I'm sure you've read in the paper and heard on television the numerous scams that people have been experiencing, everything from people promising you that they will help you get your COVID-19 stimulus package, to saying that they have a cure for COVID. Please, please, please be careful. Review one of the resources that's available is the U.S. Department of the Treasury has a website called COVID-19 Scams. Please review that and be careful. I'd like to now just go over some important community resources that, again, if you don't need them, please share them with other people, with your family, with your friends, with your neighbors, because these can be lifelines for you and for people that you love. New Jersey, for a number of years, has had it's called New Jersey 211. It's a statewide information and referral service where you can get a host of information about different resources that you might need during this period and beyond. Don't hesitate to call. There's still people on that line that will address your needs. Every county has an area agency on aging. Those of you in the audience may be already familiar with your local agency or office on aging. They're also called the ADRC centers, the Aging and Disability Resource Connection. They also have staff available that are ready to answer your questions about your particular county. You can go on your computer and Google Area Agency on Aging in New Jersey or ADRC, and it will come up with a list county by county of the phone numbers for each of those groups. They're tremendous help. As I had mentioned to you a few moments ago, this pandemic has caused a great deal of emotional stress. And like we talked about some of the signs that you may be experiencing or family member may be experiencing that may indicate that you need professional support and help. New Jersey developed a mental health support line that is there to talk you through, any issues that you're feeling. Let's say if you find that you're feeling more depressed or so anxious that you can't function, you can't get out of bed, you're not answering your phone, you're feeling that you want to hurt yourself, that life is not worth living, please, please, please reach out to the support line. In addition, each county has psychiatric screening services. Many of them housed right in your local emergency rooms. If you're in distress, call your nearest hospital. See if they have a psychiatric screener that you can talk to. Don't go this alone. Reach out for support. For those of you caring for loved ones with Alzheimer's disease, here's two wonderful resources that we have. One right here in New Jersey that has a wonderful helpline and these helplines are manned by master's level social workers in many cases that can help review with you everything from dealing with difficult behaviors to support services that are available for Alzheimer's patients, to physicians in the area that may be experts in Alzheimer's disease that you can connect with. Again, that's a wonderful resource that you can use. They also have both organizations have great websites chock full of information. As I had mentioned, there has been an uptick in domestic violence, unfortunately, during this period. And any of you out there that this may be talking to, or a family member, friend, or a neighbor that may be suffering during this period, please share with them these two hotline lines. If they know that the people on these hotlines know that many times victims can't talk because their perpetrator is right there near them. So I put some information about how you can text them so they will know immediately when they see this text that you're in trouble. They also have a website that you can review. We're fortunate here in New Jersey to have a specialized service that is statewide that provides toll-free help for family caregivers. That is called Care to Caregivers. It's out of Rutgers University Behavioral Health Care, where I worked for 14 years. And they have wonderful staff that are there that can listen to you, but can also link you up with some important services in the area. I've come across a Facebook grief support group. We talked about grief and how this is undergirding many of our feelings right now because of the amount of losses that so many of us are experiencing. David Kessler, again, a grief expert, has a support group where people can actually go on in Facebook and again get support from other people that are walking the same walk, so to speak. In addition to that, there are online support groups that you can access, including wonderful support groups that NAMI New Jersey is sponsoring. Consider going and utilizing a support group, so you know that you're not alone if you're struggling with the fears and anxieties and depression related to caring for yourself, as well as maybe caring for someone else during this period. There are some great websites, those of you out there that are family caregivers, that provide a lot of information and education, and again, that all important emotional support. And as knowledge is power. And the more that you're armed with information, the better that you can advocate for yourself as well as for people that you love. So here's some interesting websites here. The Caregiver Action Network in particular has some great information for caregivers of people with mental illness. I really was impressed as I read through a number of the information that they provided, questions that you can ask your loved one's doctors, what you should know in terms of rights that you as a family member may have, or you as a consumer may have. Again, really important information. And lastly, I'm sharing a book that I came across recently from Dr. Arthur Kleinman, who is a well-respected Harvard psychiatrist who does a lot of work on what's called medical anthropology, helping people understand the cultural variations in how they respond to illness and disability and how they access help. He also became a caregiver for 10 years for his wife, who suffered with Alzheimer's disease, who's now deceased. But his book was so poignant and so caring. It really gave me a whole nother look at this man who had been a resource for me as a educator and trainer, reading his books and reviewing a lot of his articles. But this is a wonderful resource for those of you, especially that may be caregiving, from the aspect of a doctor as well as a husband caring for his wife. In sum, as we think about this period, and we know that as difficult as it is, this period will leave us. We don't know when, but this too shall pass. And during this time, you're doing the best that you can with what you know. Don't get caught up in what I call the coulda, woulda, shouldas. Use this time to try something new, embrace yourself. You have the time now to think about your life and how things could be different. Sometimes adversity becomes a blessing in disguise for us. And hopefully for all of you out there, this will be that blessing, in the sense that it can open up some new possibilities for you. Remember, you seniors out there, and especially you are part of that greatest generation, the people that have taught all of us, how to be resilient. Use those skills and that outlook on life, and the life experiences that have helped you survive up to now, to survive this. You can. Thank you so much for being out here today, for listening. I hope some of if not all of the information that I've shared with you today will be helpful for you on your journey. Thank you so much.
We will now be responding to the questions in the Q&A chat. Question number 1, dealing with loss and grief due to COVID and this new norm, how do I direct seniors to reframing as I speak with them daily at my job via phone calls?
That's a very good question. One of the things that we forget when we're in the middle of grief or anxiety or depression is who we've been, who we were before. The seniors that you're talking to probably have a lifetime of experiences of coping with all different types of adversity and getting through it and surviving it. One of the things I did as a mental health clinician is I had people talk about, have you ever had a period in your life where you faced something really tough? Tell me about it. And helping them point out what they did to get through it. that certainly it's important for us to get help and support. That's probably why they're calling you. But it's also important to get back in touch with, what do I have? What kind of strength I have inside of me? So that's one of the things that I would suggest that you do, is really help them pinpoint what is it that they can do, and really encourage and praise to the hilt, and make sure you ask them to follow up with you to see how things worked out, and again, praise those things that they've been able to do on their own, to get through whatever problem they're sharing with you, including coping with the grief. It's also important for you to, encourage them to connect with other grievers through the online grief support groups, that, again, they know that they're not alone. They'll hear other people say things that they themselves might be experiencing, so they know that they're not weird or strange or, or crazy, that they're going through a normal process of grief. Thank you for that question. It's a very good one.
Okay. Question number 2. My husband is 10 years senior to me, has decided he is not leaving the home environment until the health department has a vaccine for COVID-19. My husband is an asthma patient who will not keep any physical appointments at the doctor's office in the neighborhood to assist himself. He says he has dealt with asthma for so many years, he is taking care of himself. That's well and good. I understand why, but I do not agree with his decision. How do I make him understand my concern for him so he does not close the door on himself?
That's a very good question, and I again applaud you for asking. That's a very complex issue. As I hear that question, one of the questions I have is, does your husband have any symptoms of dementia? Sometimes one of the hallmarks of dementia is poor judgment. And I would wonder if, in addition to the asthma, that, especially if he's older, that he might be experiencing some type of dementia. This is a situation where you need to call out all of your supports, including other family members that might be persuasive for him. His doctor, especially, my hope is that since he has a long-term chronic illness, that he's already connected with a good geriatrician or pulmonologist that's been following him for a long time. What I've found is that sometimes, as a family member, our loved ones won't listen to us, but they'll listen to the doctor, the doctor. So I would see if his doctor has a telehealth service set up. Again, Medicare, fortunately, is paying for physicians to do telemedicine, and they will get reimbursed just as if they're seeing the patient in the office. And so for right now, that's still up and running. So you want to make connections to the doctor's office, let them know, your situation, to see if your husband might be willing. I don't know if he has access to a computer at home where you can do a Zoom conference with the doctor so he can actually see the doctor and talk with him. Or if all else fails, just a good telephone call with the doctor or somebody, the doctor's nurse, making connections with your husband. Also, this might be a time to ask the doctor if your husband, if he or she might be willing to arrange for visiting nurse follow-up for your husband, since again, he has a chronic illness. That again is one of the major risk factors for COVID. He might be eligible for a home health visit from a skilled nurse practitioner that might be able to follow him, and if nothing else, to allay some of your fears that he, will be okay during this period. That's that might be an alternative that you can reach out to. It sounds like if you're still working or out of the home, this might be also a time to think about whether or not what's called a geriatric care manager might be in order. Those are professionals, many of them licensed clinical social workers or geriatric nurse practitioners, whose goal is to help older adults and their families plan for their long-term care. They do home visits. They help sit down with you as family members, to map out, what are some of the issues that are some of the resources that might be helpful. They get to know the patient over time and forge a relationship with them. This might be a time for you to begin investigating who are those people out in the community that might be able to provide those kind of services that come into the home. That way the pressure may be off of you. The last thing is considering if your husband won't go to a doctor, if a doctor can come to him. There are a number of visiting physician services now in the community that again, I don't know because of COVID what restrictions there might be now, but it is worth a try to look at and to Google visiting physician services in whatever county you live in to see if that's another resource. So those are some possibilities that you might consider.
Okay. Dale, thank you so much for joining us and sharing with us the valuable information.
Thank you so much, and thank you, and the best to all of you in the audience.
Before we close the webinar, I would like to share with our participants our online resources and information from the NAMI New Jersey website. From our front page, if you go to our Get Involved page, click on Become a Member, you can find out about how to become a member. That being said, all our programs are free. On our front page, you can go to the COVID-19 information page. You will be able to access all our resources and services. You will find where our statewide online support groups are, affiliate support groups, multicultural programs, signature programs, as well as our webinars. Like this one, where we will post the recording along with the presentation slides. Feel free to reach out to NAMI New Jersey for any support you might need. Thank you all again for sharing this hour with us today. As a reminder, it would be appreciated if you could complete the survey at the end of this webinar so that we can incorporate your feedback for the future webinars. This concludes our webinar, and thank you all.